Hello, I'm Karen Miller, physical therapist assistant, and I'm going to talk to you about metatarsalgial pain of the foot. The pain is usually associated with repetitive running and jumping, and the symptoms you may be experiencing can be a burning, numbness, tingling, or the feeling of a pebble in the ball of your foot. Some of the causes of metatarsalgial pain are repetitive running, jumping, and high-impact sport activities, improper footwear that is too loose or too tight, previous history of stress fractures to the foot, obesity and excessive weight, and foot deformities. One of the ways to manage metatarsalgial pain is by using an inner sole. An inner sole provides support to the arch and padding to the underside of the foot and the ball of foot during activity. Place this inside your footwear and try it on. If it feels as if it's too tight, please remove the manufacturer inner sole and just use this additional one. Another way to manage metatarsalgial pain is by using a toe pad. A toe pad is placed around the second toe to the ball of the foot and provides pain relief and cushion when standing and doing activities. This can be worn daily with any shoe wear. Another way to manage pain associated with standing and having metatarsalgial pain is by using a silicone pad to provide cushion to the footwear. The silicone pads have an adhesive backing that sticks to the inside of your shoe at the ball of your foot and provides cushion and comfort when standing or doing activities. This can be worn daily and left in your shoes. Massage is a great way to relieve metatarsalgial pain. I'm going to use Dr. Pat's pain relieving gel during this massage. Take a small amount and apply to the ball of the foot and rub it in. And using your thumb, apply firm pressure to the ball of the foot in circular motions to the area that's painful. Once the gel is absorbed, you can stop your massage. This can be applied 2 to 3 times a day. Another way to manage metatarsalgial pain is by stretching. Extend each toe and apply light to moderate pressure to the toe to stretch the underside of the foot. You want to hold each stretch for 10 to 15 seconds and work your way from one end to the next. And you can perform this 2 to 3 times a day as tolerated. Another way to manage metatarsalgial pain is by massage. I recommend using a spiked roller ball to massage the underside and ball of the foot daily. I would recommend doing this 2 to 3 times every day to help ease pain and provide comfort and pain relief to the underside of the foot. Place the foot gently on the roller ball and perform circular rotations clockwise and counterclockwise at least 10 to 15 times in each direction, 2 to 3 times every day. Metatarsalgial pain can be managed with ice. I recommend using an ice pack, putting the ice to the underside of the foot and velcroing the strap around to hold it in place. Remember to ice 2 to 3 times a day for 15 to 20 minutes as tolerated. Exercise is a good way to manage metatarsalgial pain. For this exercise, we're going to do a toe scrunch. Place a towel on the floor, and using your toes, you want to scrunch the towel underneath the toes and then extend. You can repeat this exercise 10 to 15 times, 2 to 3 times a day. Thank you for watching our videos on how to manage metatarsalgial pain. I hope you found the information useful. Remember, if the pain persists, please consult your physician.